Dr. Kemker, is there a ideal time to have it done such that if you wait too long, you might get past the time when you could, so you need to do it? And of course, that would be something you would help somebody realize.
Sure, I definitely help people try to negotiate how to best handle their arthritis, because like I said before, I'm not going to push a surgery except in a couple rare cases. The hip, you can wait a little bit longer, but if you start getting deconditioned, the first thing that goes are the muscles that help you stand, walk, and get around. Once those start going, your recovery is just harder. I don't think you'd still benefit from the pain relief from it, but you'd have a harder recovery and form of strength. A knee replacement, there is a sweet spot though. The sweet spot for a total knee is not getting it done too early, because this is not a preventative procedure. If you don't have arthritis yet, you won't want this and you shouldn't get it. But you don't want to wait too late where your knee's getting stuck. If your knee's getting stuck and it's not bending anymore, the cat's kind of getting away from us and you won't have as good of a result.
Most people with knee arthritis, though, will come to us with an inability, I'll put it over my black scrub so you can see it, with an inability to straighten out the knee completely.
Yes.
A small little inability to not straighten out your knee is something that's fixable. However, if it's really bent down significantly and you really are walking with a leg that's horribly bent or horribly angled to the outside, the result will not be as good. The bottom line is, if you go to people that specialize in getting rid of your pain without surgery, then by all means, if you need it, we'll tell you that honestly.
Right.
But it's better to come early, because the non-surgical treatments are absolutely wonderful.